testes is the primary reproductive organ of male. And if you look at the histology of a testes, we can see lots of tubules inside of it. They are your seminiferous tubule. Let's zoom into the histology. You can see that inside each seminiferous tubule, the process of spermatogenesis is going on. And in between seminiferous tubules, the interstitium has Leydig cells that produce testosterone. The testis, it is present in a sac-like structure called scrotum. And if I incise through the scrotum, I'll find a layer of fascia and muscle. The muscle is called cremasteric muscle. Cremasteric muscle can contract and relax, lifting the testis towards the body and dropping it away from the body in order to maintain temperature for spermatogenesis. Just behind the testes is epididymis, where sperm gets stored. Two things happen. Number one, sperm attains the ability to move. And number two, 99% of the testicular fluid gets absorbed, increasing the concentration of sperm. Now that sperm has gained the ability to move, it can pass through the vas deferens as well as assisted by the peristaltic movement of vas deferens and reach behind the urinary bladder. Behind the urinary bladder, it meets seminal vesicle, which produces 70% of total semen. The most important part being fructose. Sperm uses fructose to produce energy, then it uses that energy to move. The ejaculatory duct, it opens in prostatic urethra. But what else opens in prostatic urethra? The prostate. The prostate, it produces fibrinolysin, which prevents the head of the sperms to clump together, and alkaline medium. Sperms, they love alkaline medium, and prostate-specific antigen. If in blood, the level of PSA is greater than 10 nanogram per milliliter, it indicates an increased risk of prostate adenocarcinoma. Okay, so there is a pair of bulbourethral gland that produces, see, during ejaculation, passing through the spongy urethra is your semen and not urine. But sometimes few drops of urine can get into it. Sperm hates urine because urine is acidic. To neutralize that, the gland produces alkaline fluid. Second, in any slide, it is much easier to glide through it if it is wet. Similarly, the bulbourethral gland produces mucus, which lubricates the spongy urethra, making it much easier for semen to pass through it. Then there are your erectile tissues that help in the erection of penis. After erection, it is followed by ejaculation. With ejaculation comes out semen. What is semen? Semen is male sexual fluid. Talking about sexual fluid, it is important for us to know that the most common mode for transmission of HIV/AIDS is via sexual fluid, be it rectal fluid or semen or vaginal fluid. तर sexual fluid हेर्न बित्तिकै AIDS भइहाल्ने हैन. That fluid has to somehow enter inside of our body, and that takes place by coming in contact with mucous membranes, like the one present inside mouth or present inside vagina, inside rectum, and at the opening of penis. Number one, unprotected anal sex. This has the highest risk of transmission. Reason being, number one, the opening of penis is in direct contact with the mucosa of anus, and number two, there is chance of trauma. Trauma leads to bleeding. Initially, there was already risk of transmission through sexual fluid. Now there is risk of transmission through blood as well. So there is additive effect. Second, unprotected vaginal sex, or the opening of penis is in direct contact with mucosa of vagina, which carries the second highest risk. But it is the most frequent because obviously vaginal sex is more common than anal sex. And finally, oral sex. These are my sources. Thank you.